Not yet. I'm the not yet. I'm actually not that one. Not, here you go. Right. Okay. You guys should be able to see the let's set it up over here. You can even put your if you you know put it like this your if you're using cell phone or iPad, it'll show that way. It's pretty good to easier to watch. I think this is what I'm going to do. Okay. um Now, can you all see the presentation? If you can, please reply 3. So if you can hear me, you can see all the presentation PowerPoint. Please reply 3. Thank you. That's awesome. Okay, let's start. Right. So tonight's class is a free class, and if you're in Australia, you or any other country, and if you require CPD, then later on you need to complete 2 links. Okay, one is called sign in, the other one is quiz. Okay, and I only apply for pre-approval for the CPD with AACMA. So if you're AACMA members, once you get the certificate and you just send it to the AACMA, that's it. And for the others, you can email me and let me know which acupuncture association you form, and then if I got a lot of members from particular association, acupuncture association, and I'll get my team to apply for you. At least 10, okay, at least 10 members of it, from the same association. Then I'll get my team to apply for the CPD for you. May not be this webinar, but next year, we'll come up with some free one. Okay. For those who are watching the replay, and sorry you're not qualified for CPD certificate, only for those who are watching live webinar. Okay. All right. Today we have 2 topics. Number 1 is tinnitus. Number 2 is anxiety. Let's start. Okay, this is the first step. Okay, you all need to sign in. Okay, you all need to sign in. Only for those who are attending live webinar now. Okay, those who watches replay video on YouTube will not receive CPD certificate. Okay, and BMI, once you submit this link, I'll send it into the chat box later on. Let me finish it. Okay, you would receive a confirmation email once you have complete the link. Okay, do check your junk mailbox because it may be in there. Okay, if you haven't received it, hang on, give you a minute. It's coming. That's the one. If you can't see the PowerPoint, you can log out and log in again. Here you go. Go ahead, and I'll give you 2 minutes. Oh, just 1 minute at least. That's just 1 minute, and to sign in. Go ahead and sign in. And you don't need to tell me you have done it, okay? Just keep it clean and simple on the chat so people can see the link. CPE English. So click the link. What do I mean sign in? Click the link and fill your email address and your name and then submit. That's it. Do you get me? Thank you. I'm going to press the link again. So this is the way that I know, hey, you sign in. So some people come in about an hour later and they're not qualified anymore, right? So I have a system to run, but you when it comes to that, I'll explain to you, okay? So that's it. Let's keep going. 1 minute up. Right. Now, number one, tinnitus. What is tinnitus? Okay. Because I have two topics. Each topic normally I spend about 1.5 hours. Then I have a lot of things that I would like to share with you. So we'll keep it simple. What is tinnitus? Well, we all know it. It is about ringing or buzzing sound that in the ear. It could be in 1 ear, it could be in 2 ears. Okay. It could happen on the brain rather than ear. And if it happens in the brain, and in Chinese medicine, we call ringing brain, right? Now me in Chinese. Okay, so I'm not going to go through that, read through that, and then I just put it in there. If you happen to receive my PDF of this, and then you can read it yourself. All this information is from Moya Clinic website. Okay, so what is a symptom? Can be worrying, can be clicking, and could be pulsing, all this thing. Okay, I'm not going to go deep. I mainly want to show you where the point is. Okay, and this is the cause. It doesn't matter what causes that form, and try the point, it will work. Okay, it's not 100% work for you, but if it's from, I've treated from injury, I treated people say that when you get old, you get tinnitus. I've treated those cases. I treated patients who have hearing loss due to flower going to the ear, and ever since, and they got she got hearing loss. And I've treated tinnitus, injury, a trauma, or someone hit his hair. Ever since they got tinnitus, and it works pretty well for them. So if it's from medication, you need to check the medication, and they need to slowly reduce and cut off the medication. And you, as an acupuncturist, I don't actually advise my patient to stop or cut down the medication. I refer them back to their specialist or a doctor and to discuss. And then, but I want them to let me know what sort of medication they're taking, and then I will check on Google side effects. What sort of drug you put it in and side effect, and you check whether they have any side effect related to the ear. Okay. Mania disease, whatever, all this I'm not going to focus on here. So tinnitus, it could lead to hearing loss. Okay. Now in the treatment, In the treatment, in the Western medicine, there is no such a good treatment for it. There's basically no treatment available from it. And the really one thing that they do is white noise. So the white noise machine, if the patient, a lot of patients have rings in the ear and they don't care, they live with it. And that's okay. They learn to live with it. They don't actually hear it anymore. But if they pay attention on it, they can hear it. And some of them, Ryan, which one are you experiencing? Sorry, I went too fast. I didn't actually read your message. The slide one, can we get the slides in PDF after the lecture? I will. I'll think about how to send it to you guys because it's quite a big PDF. I can't previously when I in other in New Zealand or try to send it up, I can't. Maybe I can upload to Google Drive and you guys can download it. So for those, if you can't, the screen is not working, please log out and log in again. That's my best suggestion for you. So white noise are good for those people who during the day there's a lot of background sound noise and they can't hear it, but at nighttime when everything's quiet and they can hear it and they can't sleep because of that. And then now white noise is good. So buy a white noise machine and play it on while you sleep, and you can hear the white noise. White noise means there could be a raining sound or the sea wave, or whatever. Okay, and then you play it, and you can sleep. You can't hear, instead of hearing the ringing, and you hear those white noise, and then you can go to sleep. Okay. Now, this is in Western, so they can't do anything for ringing in the ear. So in Chinese medicine, we all know Chinese medicine. If you're attending here, you're either acupuncturist or Chinese medicine herbalist, right? So we have a saying that Chinese medicine, when it comes to Chinese medicine, is always weak kidney, deficiency in kidney. Now, my question for you, have you ever treated tinnitus with kidney herbs? And have those cases that you've been treating successful? Have you had a lot of successful case in treating tinnitus? I think in my experience, I've been trying very hard to find a solution for tinnitus in the last 17 years. And I started with kidney herbs. And to be honest, I felt all the time. Just a few cases, they feel a bit better, but never get instant relief with herbs. Never. What about in your experience? And I tried a lot of acupuncture technique, local point, distal points, a lot of needles, did not work. What about you? It is hard. Doesn't matter what technique you apply. Tinnitus is very difficult. Very difficult. I asked about original uh, um, um, balance method acupuncture, right? Like a lot of you have learned it. Be honest to me. When you apply balance method acupuncture, did it work well for you? For those who have been practicing balance method acupuncture, have you tried it with your patient and how's the results? Now, in my case, I tried with a lot of patients. I did not get a good result from it. Then what is the issues in here? Oh, scalp acupuncture. I went to Zhu Scalp Acupuncture. I invite Master Zhu Mingqing here, and I saw him how he treated tinnitus. Okay, and I learned some technique from him, and then it actually inspired me to do Daoying. So previously, I do needles, scalp acupuncture or balance method acupuncture on the leg or hand, and I do some massage on the ear. And from that time, ever since that, I started get good results. Okay. Then I keep searching, and I think with balance method acupuncture, I put a needle in, find the acid point needle in, find the acid point needle in, okay, or put more needle in, and I did not get. If I don't do the Daoying on the ear, I won't get good results most of the time. Occasionally, you get a bit of instant relief. Occasionally, okay, not much cases. Then I start to think in Taiwan, there is another type of acupuncture it called 非经走穴. In 非经走穴, they very require sensation, 得气 sensation. And then I started to think, if I apply balance method acupuncture with 得气 sensation, what would it help? And also, I applied the structure imbalance. So with balance method acupuncture or whatever other type of acupuncture, we are focusing on balancing organs and sick meridian, which is meridian blockage, right? But we miss something. We miss the structure. So ever since I figured out yin and yang, and then I needle with needling manipulation technique, and then I get instant results, even just one needles. That is the key that I'm going to show you today. Okay, so that I'm just sharing with you that that's how I figured out the point and the technique for tinnitus. Okay, all right. So in acupuncture, there's local point strategy and distal point strategy. And today I mainly want to show you distal point strategy. Okay, distal point strategy means the ear problem, we can needle foot, we can needle hand, we can needle scalp. Okay. Yes, today I'm going to focus on distal point strategy, and I'm going to show you some pointed on local points. Okay, and there is a video I think is for local points. Okay, what is local point selection strategies? Which means if the problem is in the head, which is if your patient suffer from headache and you needle the acupoint on the head, that's local point. If the patient come with a complaint of foot pain and you needle the foot, that's local point. Lower back pain, you needle lower back, that's the local point, right? And then what is distal point? Distal point selection means if the patient complain about headache, but you choose the point in the foot to treat the headache and you get results, this is distal point selection. Or you choose the scalp, you use the scalp acupuncture to treat the foot pain, and that is that is distal point selection, right? Are you following? I'm just telling you, showing what is distal and local point selection. I think this is so simple. So if you're following, please reply 4. Thank you. Thank you, Michelle. Jessica. Right. Thank you. All right. Acupuncture 1, 2, 3. So this is a bit different. The acupuncture 1, 2, 3, I add on quite a few things in it. So the simple 3 steps of meridian differentiation and treatment. What is acupuncture 1, 2, 3? My understanding is meridian, or we call organ differentiation and treatment. Now, in the original balance method acupuncture, is mainly talking about meridian differentiation and treatment, not normally include organs. But in the new balance method acupuncture that I'm teaching, the acupuncture 1 is finding out the 6 meridian, the 6 organs, and the yin yang food. This is the acupuncture 1. The acupuncture 2, find out the meridian, or we call treating, sorry, this is, I think, mess up, treating meridian or balance meridian through 6 system. And in this step, we decide which side to treat. So we need on left side or right side. It's an acupuncture 2. In acupuncture 3, then you decide which point to go with, to needle. And in acupuncture 3, you also add on manipulation, and you decide whether you want to do 1 needle technique or multiple needle technique. Okay, you can do multiple needle, it's up to you. If you do 1 needle technique, you must get the qi sensation. And bear in mind, not all patients like dirty sensation, but some patients love it. Okay, so you choose. If those patients doesn't mind dirty sensation, they just use 1 or 2 needles, that's it. And those people are so scared of dirty sensation, they don't like the dirty sensation, do multiple needle. Okay. In new balance method acupuncture, there's a highlight, instant results. Right. Number 2, we combine distal and local points. In the original balance method acupuncture, only do distal points. But in the new balance method acupuncture, because I combine G acupuncture into it, so there is local points and distal point, we needle it together. But we always go for distal point first and then move to local point. So this is a strategy different. You can straight away go to local point, it's up to you. But for all the new patients, I suggest do the new distal point and then move to the local points. There's a reason in that. Number 3, easy to learn and repeatable results, which means you're going to learn it tonight for the tinnitus, and tomorrow when your patient comes, you can apply it. Whatever I can, the result that I can deliver, you can too. Very simple. There's no secret in there. Number 4, apply needling manipulation technique. So in the original balance method acupuncture, you don't do the manipulation technique. Just insert a needle, ask the point, insert a needle. But in the new balance method acupuncture, one of the main points that we can deal with structure issue in tinnitus, one of the main reason in here is because we apply needling manipulation technique. So are you following? If you are, please reply 5. Okay, this is so important here. Super, super important. Okay, this is acupuncture 1. Remember I said acupuncture 1, we do yin yang. We figure out which side is yin, which side is yang. Okay, this is acupuncture 1. Observation of yin and yang. We're talking about food. Okay, now what is the process? So you need a firm base. And number 2, do not have any wallet in the back pocket. Okay, first you stand on the patient feet. So the patient is actually on the back, on their back, okay, laying like this. Okay. Okay. Then what happened is, this is you. Okay. My 2 finger, this is you, the practitioner. First, the practitioner come to the feet side. And then what you do is push the thumb, not the thumb, sorry, the big toes joints over here, and push it toward to the bed. So the little toes touch the bed, and you let go, and then it bounces itself back. A few times, 5, 6, 10, up to you. And you want the patient to be relaxed. Do not move. When you finish that, then this is you. You go to the head side. Now you're over here. From here, you look, use your eyes, of course. Look at the feet. Okay. For me, I normally just take a picture from that. Take a picture, and I can show patient. Okay. Over here, as you can see here. Now you can see, all right? You see, this is right side. This side. This side is toward to outward, right? And this side, left side, is going inward. So toward outward in yang. Why is it yang? This side is yang, right? Yang expect. And the inside is in expect. Here's in expect. And when it go toward to the little toe side, which is toward to the yang, then we call this leg is yang foot. So in this case, right foot yang. That's it. The yin yang foot diagnosis complete. When we know this is right yang, of course, left is going to be definitely left in. Does that make sense to you? Okay. The image that in here you see, you can't see my mouth, can you? I have to do this. Otherwise, you can't see the mouth. I'm pointing. Now you can see my mouth. My mouse, not mouth. Mouse. Do you see? In the left image, right foot is toward to the little toes, right little toe side, which is yang leg. So right foot yang. And of course, left foot is in. In the left image over here, this one, you see the left foot toward to the left little toes. right? And the right foot is toward to the right big toes, which means the right foot is also toward to the left little toes. So in this case, left foot yang, right? Do you get me? If you are following, please, please reply 6. If you have trouble understanding what I was saying, please reply 7. We just want to work out which size yin, which size yang. That's it. Please repeat. Okay. Okay, repeat, eh? So you want the patient on a firm back, and then no wallet in the back pocket, and then you're first standing on the feet side, and then you push both big toes joint and toward to the bed, which means that both side of the little joints, the little toes, try to touch the bed, and then you let go. You push and you let go. Let the feet naturally bounce back. Okay. You do it for 5 times or 10 times, up to you. You feel that, oh, the patient is relaxed now, and then you ask the patient, keep it still, do not move, and you come back to the head side, and on this side you take a picture of it. Then if you see that foot, on this case, look at me, my acupuncture model here. The right foot toward to the right little toe side. The left foot is actually coming toward to the right little toe side as well. On the right foot, little toe side is yang side. Big toe side is inside. Yin yang, eh? Inside, in expects. Yang expects on here. Now, because of this leg, the right side, the right foot toward to the yang side, little toe side. So we call it yang foot, the right yang. And the left, it more toward to the left big toe side. So this is inside. So left foot in. Okay, now do you get me? So now I want to see, for those who reply 7, can you reply, if you understand me, if you're following me, please reply 6 now. Now, both can be yang? No, never. There's always a bit of difference. Okay, depend whether you can see it or not. Okay, that is what if both external assist. If that happen, then we have to bend the knee and then test out. That's the next step, which I teach it in my workshop. Okay, but most people you can, that good point, eh? Good question. Some people you can't find it out. You have to go to the next level of testing, which bend the knee and then put the both knees outwards, and then you'll be able to see one is going up, the other one's coming down. We'll discuss it in my workshop. Okay, that's it. Now, I'm pretty sure some of you joining in. We have 110 people in here. We will having 68. So some of you have not signed in yet. So for those who are joining in just now you can go and sign in. What is the purpose of it? I'll let you know. The purpose of yin and yang indicate structure imbalance. They indicate which side do we needle. Okay, for those who have not signed in yet, please click the link to sign in, because you have to sign in to, this is the first step, you sign in first, complete the sign in link, and then in the end, I want you to complete the quiz link as well. So once you complete those two links, then you qualify for CPD certificate. All right. If you only complete one of the link, you can't prove yourself, and I can't prove you're here tonight. Okay. And once you complete the link, you will receive a confirmation email. So you're going to receive two confirmation email tonight. Okay. One is sign in, one is quiz link. Okay. Right. Let's continue. The link does work, because I can see a lot of people done it already. It does work. Please copy it to other internet browser. Okay, let's continue. Okay. Now back to here. Now, why do we do this? That means you are going to needle. If you choose the foot yang, 3 yang, either of the yang meridian to needle, you are going to needle on the yang foot. If you are needling foot in meridian, you're going to needle on foot inside. This is very important. This is super important. Okay, do you get me? Are you following? When it comes to needling on the foot, if you're choosing the point on the yang meridian, foot yang meridian, you only needle on the foot yang side. On the foot yang side, look at the image in here. The left image, this is right foot yang, right? If you needle stomach meridian, gallbladder meridian, or UB meridian, you only needle on the right foot. Do not needle on the left foot. Okay. Now, if you choose the meridian to needle, and the meridian is 3 foot in, which is kidney, liver, and spleen, you only needle on the left foot. In this case, we're talking about the left image, because the left foot in. Okay, are you following? If you are, please. If you needle on the other side, you may still get results. It's not going to last. Why is that? Because you definitely balance the meridian and organs, but you miss the structure. You miss the structure. Now, if you needle the side that I show you today, you not only balance the meridian and organs, you also balance the structure. Do you get me? You can do a very simple test on your patient. I do it all the time. So if you know balance method acupuncture and you figure out the yin and yang, if you're choosing one point on the foot, let's say neck pain, and you or let's say neck pain, okay, neck pain, and you're choosing the point on, I don't know the English code, Kunlun point, and you find Kunlun point is very sensitive on both sides. Then you press on Kunlun point on one side. In this case, you press it on the left side. Right foot is yang. You press on the left side. You ask patient to move the neck, and they say, "Oh, okay, that's better. The neck pain is better." Just no needle, just acupressure point, and you let go, and you use your thumb pressure on the opposite side, which is yang foot side. Press the answer point on there. You ask patient to move it, and that's better too. The patient said, and then you ask the patient, which side worked better? The patient will tell you. I just did another case for my colleague the other day, and the patient said both point work very well. I don't feel pain, but on that side, it works even better. I can't even feel the tightness and the stiffness. And this side, when I press on it, he said, the pain's gone, but I can still feel the tightness and stiffness. Why is that? Because when I press on this side, I balance organs, meridian, as well as structure. When I press on that side, I'll only balance meridian, organ, but not structure. Oh, UB60, thank you. Do you get me now? Look, this is a very interesting question. What should I do if neither side works? Always choose the better side, which is the yang side. Because the lasting result with a lot of needle balance method acupuncture, you put needle and sometimes you take out a needle, the patient say, oh, the pain came back. That happened. But if you do this, it's not going to happen anymore. I haven't had this complaint for years. I take out a needle, patient will say, they never complain about, oh, the pain came back as soon as you take out a needle. Why is that? Because I balance the structure as well. Right? Try it yourself and see, experience it yourself. This is very important. Okay, let's go. Now with acupuncture 1, we know yin and yang foot, and then acupuncture 1, we also need to find out the 6 meridians. I have to go quick because we spent about 48 minutes to talk about yin and yang. Over here, the we need to find out the meridian around the ear. Okay, the first meridian, we have 3 meridian come to 3 points on in front of the ear, and the first one in here is called Szenan-Balance meridian. They go back behind your ear, the closer to the ear in the back. This is Szenan-Balance meridian. Okay, and the next one over here, this is small intestine meridian. You see, small intestine meridian. So 2 meridian around the ear. The other meridian in here, this is gallbladder meridian. So gallbladder meridian on the external eye side. the corner of the eyes, over here, and go up there. You see my mouse, and go to the side of the head. This is gallbladder meridian. Okay, so those three meridians surround the ear. So when there is a blockage, or when there is a blockage, or if the muscle is very tight in the neck, it'll cause tinnitus. So the tinnitus not just related to the kidney, it also related to the meridian surrounds the ear. And how do you unblock the meridian? Either we use local point or we use distal points, right? Then do we treat only the meridians? Do we need to think about to treat kidney? I'm not just talking about deficiency kidney organ. Think about if there is a blockage in the kidney, would the qi and blood supply from the kidney to the ear? No. So don't just put it in mind that all tinnitus is because of kidney deficiency. It could be the blockage in the kidney meridian, right? Are you following? If you are, please reply 8. Make sense, eh? Awesome. Simple. Next one. Okay, today I'm going to show you distal acupuncture point to treat tinnitus. Acupuncture 1, 6 meridian and organs, right? The 6 meridian, I don't know which meridian, to be honest, but I know 3 meridians surround the ear, so I'm going to treat them all. Does it make sense? So we treat Szenan-Balance, small intestine, gallbladder. I treat them all. And the 6th organ, kidney. So on the acupuncture 1, 6 meridian and 6 organ, I have 4, which is Szenan-Balance, small intestine, gallbladder, and kidney. So in acupuncture 2, I'm going to choose some meridian that's on the leg that are able to balance all 6 meridians and organ. Okay, in acupuncture 2, I choose GB, gallbladder. And in the 6 system, balance method acupuncture 6 systems, I don't show you the system here. I don't have the time, but the quick one in here. This is the results. Okay, gallbladder can balance Szenan and gallbladder. Look, Szenan and gallbladder. I have 4 6 meridian and organs. Now I can just needle GB. I can balance 2 of the 6 meridians. Then liver. If I choose liver to needle, and liver can balance small intestine and GB. Again, 2 of the 6 meridians have been taken care of. Kidney, if I needle kidney, Szenan and kidney. Kidney can balance Szenan and can balance kidney. So only 3 meridians on the foot, then it can take care of all the 6 meridians in organs. Right? So I only need to needle 3 meridian. then all those 3 meridians, it can take care of all the 6 meridians and organs. Now, are you following? Please reply 9 if you're following. Oh, what's going on? Simple, right? Okay, let me tell you. If your needle GB, you only needle on the yang foot side. If you're needling liver, meridian, and kidney, you only needle on the in foot side. Okay, acupuncture 3. Microsystem image. So the microsystem image over here, you don't need to know what's going on inside. Okay, we cut it short. We just need to know the outlook of the ear from the top to the bottom earlobe. Okay, observation of the outer ear to determine the ear microsystem position of the leg, because we're going to needle the leg, right? And how do we figure it out? Okay, look at me. Okay, focus on me. Okay, my screen. You look, this is the ear, the top of the ear. Going toward that, it will be the eyebrow. And here, your earlobe bottom here, going to that, it's going to be about 人中, approximately on the level, same level of 人中. Okay? So in this part, that is come to here, right? Here to here. So in the microsystem, the eye on the leg is the knee level. The chin is the ankle. So this is the eye level. This is the chin level. So from here, eye and chin, halfway is about 人中point, okay? So the ear is from the eye to 人中. So if this is the eye, you see this is the image, microsystem, knee is eye, ankle is chin, in which 人中 is between knee and ankle, or we call eyes and chin, halfway. So from here to here, halfway, that is the halfway, the ear, cover the ear image. Okay, if we do a reverse, there's a reverse, and when we do a reverse, that part will also treat the upper part over here, the upper ear over here. Okay, I'm not going to go deep, I don't have much time, but just this the idea, and I'll go very detailed in my workshop on this. Okay, or in my other webinar. Okay, all right, do you get me so far? If you do, please reply 1. I think someone dodgy, some people is very dodgy, they're coming in to our and saying a lot of things. I don't know what you're talking about. What? Oh God, someone just come in to our life. Just a knock. And I haven't referring to any point yet. Okay. Now, look, I'm giving you the point right now. I'm choosing, we know the image, right? Now I'm choosing the RC point around GB34. GB34, you should needle on the yang foot side. Wow. Look at me. GB34 is over here. On this case, this is yang foot, right? GB34, yang ling quan. I'm giving you the point. I'm not asking you to needle this point directly. I want you to find R point. The R point would be maybe GB34, maybe on here. So you need to find along the GB34, maybe at between stomach and GB34. Go to this area to find the R point. Maybe a bit back toward to the UB meridian, but closer to GB meridian. From here to here, find the R point. Then needle it. Only on the yang foot side. Now, on the liver and kidney, I like to do a simple way. Rather than on the liver meridian or kidney meridian, I prefer a between. I go to kidney meridian, between the kidney meridian and liver meridian, and I find the R point from the knee to the halfway here. I find the R point. You get me? Because I'm going to do the manipulation. Later on, I'll show you how to do it. And when I go to the front, I can needle to the liver meridian. When I go to the back, I can needle to the kidney. Unless I can't find any R point over there, I'll go to liver meridian or kidney meridian. And be in mind, when you needle liver and kidney meridian, you only needle on the in-foot side. Right? Are you following? If you are, please reply 2. Awesome. Okay, on a local point, I don't have time to talk about local point, but this is mainly for distal point, but I give it to you in here. Szenan-Balance 21, small intestine 19, you only needle on the in-foot side. GB2 and Szenan-Balance 17, you only needle on the yang foot side. Okay, open Szenan-Balance 21, small intestine 19, GB2, you need to ask the patient open the mouth and insert the needle. And I use 40 mm needle. I can go to the needle completely. 40 mm going in. And I only use thin needle and 0.18 or 0.20 mm. Okay? Not going to go deep. Yep. 0.20 or 0.22 times 40. Okay. This is an important part. I want everyone to do it together. So what I'm going to do, you have to answer the quiz, right? And I'll send you the link later on. But at the moment, we need to figure out what you have learned and what is the answer. Okay? And number 1, which following meridian surround ear? A, Szenan-Balance, B, small intestine, C, GB, D, lung. Which one? A, B, C. That's right. Thank you. So A, B, C. Well, you have to take the not the answer, okay? Number 2, which organ does ears belong to? A, liver, B, heart, C, spleen, D, kidney. D, thank you. Number 3, which following distal acupuncture point could reduce ringing sound in the ears? O, ears over here, ear, Szenan-Balance 21, B, Szenan-Balance 19, C, GB2, D, GB34. D, right? We're talking about distal point, not local point. Number 4, only needle kidney channel of foot area and liver channel of foot area on the side of the higher shoulder. Sorry. The higher shoulder mean in foot side. In foot side. The higher shoulder mean in foot side. Is it true or false? A, yes. Thank you. Number 5, only needle GB channel of foot area on the side of lower shoulder means young foot side. True or false? Young foot side. True. Thank you. Right, you should take a picture of this. All answer in here. Do a screenshot so later on you can refer to the answer. You done? If you done the screenshot, please reply to. Okay, that's it. This is some video that I'm going to show you. Alright. Can you hear the ringing in your ear on both sides, right?
Yeah.
How bad is the out of 10?
Well, I don't know how loud a 10 is, but I would say 5.
Okay, you say 5? Okay, let's see.
It's all quite tight in there. Yes, that one.
That one?
Yeah.
So the patient hear the ringing sound 5 out of 10.
Going down or up or to the side?
Mm-hmm.
Right. Let me know
So,
when you feel.
unfortunately, you can't see it. But I have another video that we can see it. Let's look at the results.
That went down.
Oh, here?
Yeah, down there.
How's your ringing? Yeah.
So it's much less in my right ear and probably a 4 in my left.
Okay. And right ear is less?
I think it's less here.
Okay. Okay, that's good again. Right. Let's apply it on your ear now. On your head first.
So after just the point over here, and she felt less. Okay, can't remember, probably down to 4 or 3. Okay, and the ear, each side is a bit different. So I want to show you this one first. So this one's a bit more clear, and this patient is, I think, Cambodian Chinese. She was here not because of the tinnitus, it was because of the hearing loss. Okay, I told you the same point. Okay, it's more clear in here. Let's see, look at this.
Không sao hả? Ý đồ hả? Ý đồ mà.冇咁犀利。呢度最痛。係最係個頂，個頂個肉咁好痛。Okay，呢度嚇。Okay.
So I'm going to the point between liver and kidney. I got the point. I push the needle in and out.
Em có cảm覺傳落去啊？有冇傳落去啊？我見即係見痛，唔 Lý túc có chấm có càng thông.
呢度痛啫，呢度有冇上嘅？冇。
Một kim sữa.
OK，冇。呢度有冇？
Có đồ dạo sự canh trên lọc.
呢度，呢度啊？
係。
OK。
You see where I find the point? And between halfway, lower leg halfway to the knee. In the area that I find the point is between kidney and liver meridian.
有冇感覺啊？呢度？
有啊。
有感覺啊？摸落去啦，摸落個腳啊。
係啊。
多啲心啊！呢度。放鬆放鬆，你唔使喐啊，唔使喐啊。痛喺度。
GB34 around GB34
都有嘅。
係。
呢度有冇？冇嘅。呢度最痛。
係啊，個得病係個得病痛，你個病都有痛。
呢度最傷。好，有冇落去啊腳？
未見有啦。
就係呢度啫嚇，呢度有冇一針嚇？會太痛冇？冇痛嘅嚇。嚇，有冇咁拉一拉啊？
冇見。
冇見啊？
都唔見痛。
唔見痛嚇，好唔緊要，唔緊要。
而家呢，你係咁喐呢，有啲少少痛。
有啲少少痛。好啦，係咁，我試下你醫下。
Okay, this video is mainly showing you the technique and how do I find the point. This is more clear than the previous needle. And this patient have hearing loss and I think left ear, and she was only able to hear 2, and after those needle, she was able to hear up to 4. Okay, and then after some point over the ear, local point, and then that increased to 6. Right, so 10 is fantastic hearing. She was only able to do 2. Okay, that after just foot needle and up to 4. Okay, but she was in speaking in Chinese, so I'm not going to show you the results. But let's go to the that is the same patient of that one. So this is local point. So I want to show you some local points. After local point, what did the patient respond?
Open your mouth again. I see that your fingers tapping. Stop it now. And change the direction. Still painful. Tapping. Okay, good. That's good. Awesome. Close your mouth. Can you feel that? Is it warm again?
Not really.
So in local point, I don't do
That's okay.
push and pulling technique. I only do twitching technique. And I want the patient to feel warm inside the ear.
It's a bit sharp on that side.
When I do the needling manipulation and the patient actually close their mouth already, when I insert the needle in,
Probably a 1.
Down to 1?
I think so.
That's awesome.
Yeah.
Right.
Cool.
Just
Thank you.
keep the needle there
Yep.
for now,
Mhm.
and then I'll come back remove the needle or do the quick needle from the other side.
Okay, thanks,
Okay,
Shanna.
did you hear that? It was 5
Can you call it
ringing in the ear, and then distal point of the leg and low combined local point, and now just 1 out of 10. So that's a very fantastic result, instant results. Okay, and I want to share with you that the needle and the local point, we only twitching, and we want the patient to feel warm. When I insert the needle, I ask the patient open the mouth, and I finish inserting the needle. I ask the patient close the mouth, and I start to do the twitching technique, the needle. Okay, and when I want them to feel warm. Okay, there's another point that I discovered behind the ear, and we needle it, and then we tap the scalp bone, and the sensation going inside, not the warm, sensation going inside the ear, and that's very good to reduce tinnitus and improve hearing. I've done it for a lot of patients. So I discovered, I don't know, one day then I just clicked in my mind and I went to the point and I did it, and it worked very well for my patient. So I teach that point in my workshop. Okay. Now, the full tinnitus treatment should include, in my strategy, okay, distal point, which is legs and hands, local points that around the ears. And apart from distal points and local points, this is something that you must do, the neck muscle. Make sure enough blood circulation up to the head, to the ear. Okay. And organ rebalance. So not just focusing on the kidney, I'm actually focusing on all organs balance, because all organ balance are more important than just kidney balance. Okay. With acupuncture or and Chinese herbs. So some of the case I do Chinese herbs, but some cases I don't do Chinese herb, just acupuncture, and work very well. Okay, right. The next topic gonna be anxiety. Now, are you guys following? If you're good, please reply 3, and we follow. We keep going. Okay, thank you. And I'm going to go to this. Okay, I'm actually coming to Australia, Sydney, and Poland, and for workshop. Okay, so let me share with you my workshop. How do I do this? Stop sharing. Give you a minute, eh? Guys, this is an advertising time. The reason I do this free for everyone, because I want to promote my my course. So our company allow me to do this, to spend 2 hours this week and 2 hours next week, and give you a free course. Okay, if you want to learn more, I'm talking about New Balance Method Acupuncture. Okay, I'm coming to Sydney in January 2024. Okay, and this is the link if you want to take over and look it up. No, the recording in Sydney will just for my not for sale. Sorry, just for advertising. So it won't be recording. I'm so sorry. Okay, so the date is 19 to 21st in January. Okay, Friday to Sunday, and in Sydney. and it'll include a colorful booklet. So basically, you don't have to do a lot of notes. Okay, I'll print the presentation. I'll print it out to you and give it to you. Okay, and the full price is $1349. An early bird. Okay, as you can see that the early bird that you can save $300. That's before 15th of October. That has been passed. I understand. And now the price will be saving $200, 1149. But look, if you're joining tonight, I'm going to open the code 1049, and you have time to book it today until tomorrow. Okay, until tomorrow, 7. I'll give you 24 hours. Okay, 7 o'clock. 7 o'clock Australia time. Okay, the code will be AACMA 1049. If you want to join, you can join, and you can still get $300 discount. Okay, use the coupon code. Okay, and how do you join? You can go to down here, new student enroll here. Okay, the link is in the chat box. What are you going to learn? Day one, we're going to learn all the holographic reflection, okay, and which is a micro system. And day two, we're going to learn all the balance system, okay, and we're also going to learn the yin-yang structure imbalance and the points and how to make a diagnosis. And if you can't make the diagnosis, what's the next step to figure out the diagnosis of yin-yang? Okay, so how to apply balance method acupuncture to treat structure imbalance as well as sick meridians. And day three, we're going to go to case study. As you can see, the case study on here, we have 26. The last one is tinnitus. So we have more strategy. Tonight, I only show you one strategy. We have, in the distal point, we have four other, or no, more than 4 strategy. I work out more points. More, if this doesn't work, what's next? Okay, and I'm going to teach you, I'm going to show you how you can figure out the point yourself. Okay, and I'm going to show you the point behind the ear, which I figured out myself, that work very well for tinnitus and hearing loss. Okay, and I'm also going to teach you the naval acupuncture. When is it? Yeah, number here, day 3, how to apply balance method acupuncture theory on naval acupuncture and Bai Hui point. Just Bai Hui point, treat the entire body. Just naval acupuncture, treat the entire body. Okay, and you can go in and look at it. If once you join this class, you are one of my members. We call Plus membership, and you buy bonus and you get buy bonus and discount. What does it mean? You pay this whatever you pay, and you get a bonus. You receive a gift value at 1349. Okay, there's a free webinar online, and also you're going to get live recording webinar as well. Okay, and then you get discount, which is you get discount for if you give a value coupon of $1349 if you join my next in the future. If you join any of our course, and then you can get discounts from us, 10% of them. So you can read it yourself. I haven't got much time tonight to introduce more in here. If you have attended balance method acupuncture with other master previously, and if you want to attend my course, you don't have to pay for full price. Like if you have attended Dr. Tan, Eileen, or Dolphin class in the past, and you are only going to pay $699 before 15th of November, and up to $749 and up to $850 depending when you pay for it and registered. Okay, and if you're in Europe, here is, I'm going to Poland next year in April. Okay, and here is the link. If you're in Europe, welcome to join this. The content will be the same in Poland. It's just different date, different places. Now, if you're not quite sure whether this is right for you, hey, join the acupuncture treatment for 10 common conditions. Currently, it's $150. And what you're going to learn, you're going to learn headache, neck pain, lower back pain, knee pain, and tinnitus, numbness in hand and fingers, the very difficult case, numbness in feet, all in here. Okay, I'm going to show you distal point and local points. Okay, and I give you 2 distal points and 1 strategy, 2 strategy on distal point and 1 strategy on local point based on GE acupuncture. It's very affordable. It's only $150 US dollars, and you also get a CPD, 15 CPD with AACMA. Okay, for the previous one on the Sydney, you get 21 CPD with AACMA. Okay, we haven't updated in here, but it's been pre-approved. Okay, so with this one, if you want to join, you're not sure yet, you want to join the webinar, you can get the webinar first, a recording webinar. When you join this, and you get 10% discount if you join my next workshop. Okay, so there's a membership in here as well. You can go and learn this. And we're going to put up the price, and I think next week in 7 days. This is going up to $250 US dollars. So if you want to attend it, be fast. In 7 days, we're going to put it up to $250 for this, because people just tell me that, hey, there's way more value in this. So we have a meeting a few days ago, and we decided to put up the price. So do get it quick if you want to join. So the webinar is in here, the link. Right. Yes, I will teach naval acupuncture in the workshop, David. Do you have plan to do webinar session for the workshop in Sydney for the people who live in? No, sorry. Maybe one day I can come to Brisbane or Melbourne. I don't know. Which herbs do you recommend for assist in deficiency symptom? You have to find out which organ out of balance. Because in my experience in treating tinnitus, I don't use a lot of time I don't use the kidney deficiency herbs. I find that, some of them are kidney deficiency, but a lot of them are not. so really can't tell. Any more questions? Are you teaching naval acupuncture in your Sydney workshop? Yes. I'm teaching naval acupuncture as well. So it's a lot of value in 3 days. Okay. All right, let's keep going. Let me stop sharing. What about treating the hand? If you want to know about the arm hands, join the 10 acupuncture. The acupuncture treatment for 10 common conditions. In the tinnitus one, I show you local points, I show you hand distal point, and I show you legs distal points. Okay? If you want to know everything about tinnitus, the workshop in Sydney and Poland will be better, because I show you everything in there. Okay? BMI, if you buy the webinar, you spend $115 and you're going to get it back anyway. If you want to use your credit to get 10% discount of your future cost, here's how it works. Okay, you can read here. Go to the link, and I don't have much time because I have anxiety treatment to share with you. I'm so sorry about that. Let me stop sharing for this one, and then we can go to share the screen again. So the anxiety, I only have half an hour. I'm going to share with you with the strategies, very quick one. Because now you know a lot of the basic, so it'll be very quick. Okay, this is anxiety. Yin and yang. No question for yin and yang, okay? But in here, I want to show you how to treat the hand. If you're choosing the hand, how are you going to needle? Look, this is right yang, right? Right yang, because this legs toward to the little toes in here, and this leg toward to the big toes. So left in. If I needle yang meridian on the foot, I only needle on the right yang foot. In meridian, needle in the left in foot, right? Hand opposite. What I mean hand opposite. This is very important, okay? Hand opposite means right foot yang, left hand yang. Do you get me? Right foot yang, left hand yang. If I want to needle any meridian on the hand yang meridian, which is sanjiao, small intestine, and large intestine. In this case, I only needle on the left arm, left hand. Because right foot yang, on the opposite hand is yang. Now, if I want to needle any point on the hand meridian, which is heart meridian, pericardium, and lung meridian, I'm going to needle on the right hand. Why is that? Because left foot is in, the opposite of left foot in, which is right hand is in. Why? Do you get me? If you get me, please, if you're following, please. David, you're so smart. This is imbalanced method acupuncture. This is yin-yang dynamic balance. And when I learned GE acupuncture, I said, wow, this is dynamic balance again. And then when I learned post-balancing acupuncture, again, the three main techniques that I use in my clinic, they all following yin-yang. So I combine those three techniques together. So this is the truth, the Tao of acupuncture. Okay, if you're following, you understand what I'm talking about, please reply 4. The hand yin and yang, opposite of the foot. That's it. Okay. This is acupuncture 1, right? Figure out yin and yang foot. And now acupuncture 1, you need to figure out yin and yang hand as well. Now, that's it. Simple. When you look at the foot, yin and yang, you know the leg, a hand and yin and yang, right? Now, what is an anxiety? I'm not going to go through everything. We use this to do the acupuncture 1, 6 meridians and organs. Here are 10 of the common symptoms and treatment of this disorder, which is anxiety. Persistent worry could be heart organ, could be spleen organ, could be stomach organs. So that's six sick organs. Fatigue could come from either of the organs or all the organs out of any of the organs out of balance. It can cause fatigue. Do you agree? Not just kidney, not just spleen, any organs out of balance can cause fatigue, tiredness. Do you agree? Yes. So the sick meridian or sick 脏腑 organ could be 12 of them, or could be 14, could be 1 or 2 meridian, right? The overthinking, who control brain? Kidney. Who control thinking? Heart. So the sick meridian could be heart and kidney. And some people get twitching and tempering feeling, shaking. On hands and legs shaking. That could be muscle issues, stomach and spleen. It could be tendons, liver problem. So I missed liver in here. Fear and of uncertainty, that's kidney. Sleeping problem, who controls sleeping? Heart, Shen, right? So the rest of it will be, we covered already, those symptoms, all organs in here. So to be honest, anxiety, the sick meridian and organs, 12 of them. All the organs in here, okay? We're going to go fast, okay? Case 1, number 1 case. This is a real case, okay, from my clinic. In my clinic, okay, real case. But I did not put the name out and show you the patient details. But those are real, this is a real case, okay? The patient comes here, I can't work. Worry a lot, palpitation when anxious. When they're anxious, you feel palpitation. Palpitation, heart. Anxious, spleen. 4 or 5 times bowel movement daily. Spleen. Loose stools. Low energy. Low energy could be 12, right? Could be any of it. Could be just spleen. Could be heart, So let's keep it simple. Let's say this is heart and spleen. Just heart and spleen. I have a better way to figure out which organs are out of balance. If you look, people come to you low energy. It could be any of the organs. You have to ask a lot of questions. I use pulse, taking pulse and figuring out what's going on. So acupuncture 1, heart and spleen in this case, okay? Acupuncture 2, heart and spleen. I choose, this is a global balance. It called spleen heart Sao Yang pattern. Spleen heart Sao Yang pattern. So the symbol of here negative mean in meridian. This in meridian. This is yang meridian. This is yang meridian. What does that mean? This patient over here is right yang, right foot yang. Okay? So spleen heart Sao Yang. Spleen meridian, put it on here, on the inside, in foot side. And heart is in meridian, so opposite spleen will be right hand. What is Sao Yang? Foot Sao Yang, GB meridian. Hand Sao Yang, Sanjiao meridian. So foot Sao Yang, we put it on the right side because right leg is Yang. And the opposite hand is Yang, which is Sanjiao. So this patient is right foot Yang. If the patient come to you is left foot Yang, you're going to do the opposite, which means you swap GB and spleen, heart and Sanjiao. Do you get me? Which if If this side, left foot is yang, then GB in here, and sanjiao on the right hand. And now right foot is in, so spleen in this side. And the opposite, which is right, left hand, is hard. Okay, do you get me? The yin yang. Okay. If you are following, please reply 5. I only see you one pattern. There could be 2 patterns in here, like two pattern of yin yang. Okay, good. Thank you for replying. Okay, over here, acupuncture 3, microsystem image. The patients here mainly for palpitation, anxiety. When anxiety happen, worry a lot, and palpitations are the main issues. And bowel motion, 3, 4 to 5 times bowel motion, spleen. And what we're going to do, palpitations in here, location. So we choose the point over here and over here. You see, this is the image. This part of the hand and this part of the foot can balance here. So we choose the point from here to here. And we do a reverse. We put hand down here, and this part and this part can treat the lower tummy as well. Okay? Can treat lower tummy as well. So we choose those points for this patient. Heart 4, 零道，外观三焦 5, 三阴交 spleen 6, 阳陵泉 GB 34. And we also add on 220, 224, and 印堂，百会神庭印堂。Those are calm the sun, help the patient relax even more. Okay, this is the strategy points. The point, that reason I choose those points because they can balance the heart, the palpitation symptoms, and the gut issue over here. So I choose those points. Okay, are you following so far? If you're following, please reply 6. I move very fast, okay, because there are 2 other strategies that I'm going to show you. This is this case 1. Okay, number 2. That's another strategy for this patient. Totally the same patient, but over here, you see, I said acupuncture 1 to treat anxiety 1. The case will be the same, anxiety 2. Same complaint, but I work on different, I focus on the different symptoms. Let's say anxious, still go to heart and spleen, 6 meridian, and 4 to 5 times bowel motion daily. We were thinking of just spleen. What if stomach, large intestine, and small intestine also involved? And low energy, again, I don't know where the low energy come from. It can come from 12 Zhangfu organs. This is the issues. When you just ask the patient, how do you feel? It comes up with a lot of symptoms, and all the symptoms can go to can link to many of the organs in meridian. That's why we need to have a better diagnostic tool. I choose pulse. I use tongue to figure out all these many conditions in 6 meridian. Which one is the real one we need to treat? Okay, but I show you all this because I can't show you the pulse. So that could be another strategy apply for this patient. But I keep it simple. I actually did it this strategy. I treat this patient with this strategy. Because I use pulse, I can figure out which organs out of balance, really out of balance. I treat that one. So if you can't figure out which organs out of balance, the real organs out of balance, you see everything out of balance, then you choose this one. So the 6 meridian acupuncture 1, heart, spleen, stomach, large intestine, and small intestine. If I'm only treating here those, which means I forget about the low. Let's forget about the low energy 12 Zhangfu meridian. We treat it as a third strategy. Okay, let's only treat from here to here. Focus on that. I come up with another strategy. We were using spleen, heart, Shaoyang pattern. Right now, I'm adding on Tai Yin Yang Ming pattern. What does Tai Yin Yang Ming? Tai Yin Yang Ming can cover the 6 meridian of here. You see, stomach meridian is Yang Ming meridian. Large intestine meridian is Yang Ming meridian. Okay. So over here, Tai Yin Yang Ming, I treat lung, Tai Yin, spleen, Tai Yin, large intestine, stomach meridian, Tai Yin. So I put all, again, we know this is the previous one. Spleen, heart, Shaoyang. Spleen, heart, Shaoyang. Now I add on Tai Yin Yang Ming. Tai Yin Yang Ming is over here. The green one, the purple one. Tai Yin is over here. Spleen, lung, they both Tai Yin. One hand Tai Yin, one foot Tai Yin. Yang Ming, large intestine, Yang Ming, stomach meridian, Yang Ming. So add on those meridian. When I add the meridian in to this pattern, we need to match the yin yang pattern. Okay. So the stomach will go with gallbladder, large intestine go with sanjiao, the side of sanjiao, lung go to heart, spleen. Okay. We do the same. The symptoms the same, so we do this part because this part can treat the palpitation as well as the gut. So we add on the Tai Yin Yang Ming one, the blue background color. Lung, we use lung 7. Stomach, we do stomach 36. Large intestine, we do large intestine 3. And spleen, we do spleen 6. All right. So all this point are able to treat anxiety as well in this case. Now, my question for you, if I'm treating all 12 Zhangfu organs, then I'm going to have the third strategy. The third strategy we call a magical 12 pattern. On a magical 12 pattern, I mean I treat all the meridians because the patient have low energy, and the all low energy could cause from all the organs out of balance. Again, how do I know that? I can use pulse. I can find out from the pulse. The pulse can tell me whether it's all organs out of balance or just 2 organs out of balance. So the pulse can tell me that whether I should apply strategy 1 or 2 or 3 here. Okay. Anxiety, strategy 3. So put all the in meridian on hand in meridian on that side. That's because left foot is in. Okay, so right foot is yang. So all 3 foot yang meridian here, all 3 hand yang meridian is the opposite of it. Okay, and this is the point. Lung 7, PC 6, heart 4. This is on the right hand, and the opposite, because the opposite is left foot in, so spleen 6, liver 3, kidney 7. So the right foot is yang, so we do stomach 36, GB 34, UB 55, Fei Yang. And the opposite, which is right and left hand, is yang. So all the hand yang meridian here, large intestine 4, Sanjiao 5, small intestine 6. And we add on the Bai Hui Shen Ting and Yin Tang on the head. This is magical 12. So the anxiety, I gave you 3 strategies. Because most of the anxiety they come, they have palpitation and loose bowel motions. I do have patients have constipation with anxiety, worry a lot, but most of the case they come with loose bowel motion and with palpitation. Okay, so I give you the choose that. So those 3 patterns can apply for any patient come with you and they get anxious and get palpitation and get loose bowel motion. Just apply either of this. Okay, are you following? If you are, please reply 7. Let's discuss. Do you, when you treat anxiety and worry, do you really find, in my case, is it just me? I don't think it's me, because I see a lot of anxiety patients and they come with, they say, oh, I'm bloating, I have stomach pain, and then I get, some of them don't have bloating and stomach pain, but they tend to get loose bowel motion rather than constipation. I do have few cases with constipation, or some of them say, oh, my bowel motion is normal, but most of the case they complain about loose bowel motion. Is it in your case too? Or because they're living in Hamilton, that's why they get similar symptoms, right? Yeah. And palpitation, yeah. I have a patient with her anxiety. She does not get palpitation, but she get hot flashes. Not many cases though, but I do have one recently. Hot flashes, especially at nighttime. Anxious, hot flashes, and wake her up and get hot flashes. And sometimes sweating at night, sometimes not. But she told me that that's her anxiety. Very clear. She's anxious. I wake up anxious and they get hot flashes. Yeah, palm stone, throat, tight chest. Yeah, agree. Okay, that's it. I don't have time for this. This is children anxiety support treatment review, and this is the mom and just talk in the video about how well her kids doing. Okay, let's go to here. I'm sorry I did not read that one for you in the past in the beginning. So that's going to be funny. But I'll give you the answer anyway. Oops. There should be. Oh, anyway, it changed. Number one question. It's quite normal for people to have feeling of anxiety once in a while. This is especially true for people who live stressful lives. But when the anxiety becomes excessive, then it becomes a problem. You might start feeling so anxious that you can't control it and it interferes with your life. When you feel this way, you may already suffer from general anxiety disorder. True or false? The answer is true. Okay, thank you. And I'll give you this, so don't you worry. Okay. Spleen heart Saoyang pattern can balance both spleen, heart, GB, Sanjiao, meridian, and organs. Truth or false? Truth. A. Thank you. Magical 12 pattern treat all 12 Zhangfu organs in balance and all 12 meridians in balance. It means magical 12 pattern is not only treating the Zhangfu organs, it also treats the meridian as well. Truth or false? A. That's right. True. The last one, structure imbalance would not cause Zhangfu organs imbalance. Treating anxiety does not need to consider structure imbalance. Truth or false? I did not actually mention this one. B. Okay, false. This is the answer. Take a screenshot. It's B. So it does. That's why I, especially in this case, the kids respond very well with some of the local points because I can tell straight away that the kids have structure imbalance. And when I do the structure imbalance, I don't leave the needles just in and out. And then when I treat the pulse, treat the organs, I leave the needle for 15 minutes. Okay, I should give you this link now. For the AACMA acupuncturist, please submit quiz survey for receiving CPD certificate. You must complete the sign-in link. Then you complete this quiz link. Both of them. Okay, both of them. You must do this. And if you're watching the replay on YouTube and you somehow you get to the link, it's not gonna help you. Okay, you won't qualify for certificate. Okay, only for who watching the live video tonight. And remember, when you submit that quiz and the previous sign-in link, and you will receive a confirmation email once you have completed the link. And it's important to keep the link because if you find out that you did not get the CPD certificate, and then you can show me the email, the confirmation email that, hey, I have submitted, but it doesn't show on your Excel's name list, something like that. Okay. Here you go. This is the link. Go ahead and click and did the answer all the quiz. You must complete tonight. If you complete the link tomorrow, it does not count. Okay? You won't qualify for it. You must complete the link tonight. I mean now. I just sent the link. Lulu. The link is over here. Here's the link. I post 3 links, same link. The link is working. The link is working. So you might have to copy and put it on other. I've tested already, and I just tested again. The link is working, no problem at all. So for those who want to join the workshop and or the online courses, you have to do it as soon as possible because the price is going to go up to $250 next week. And the workshop, you still get 300 discount in the next 24 hours. Okay. And otherwise, if you wait until next week to sign up, and you would only get $200 discount. Okay. Rather than $300 discount. This is an early price. Okay. And I guarantee you learn a lot from it. Okay. You're welcome. Catherine, you're welcome. If you guys have any question, and you can email us. And how to enroll the reversion sessions. We'll send you the link of replay video on YouTube. And please, if you have WhatsApp, my WhatsApp ID is here's my WhatsApp, and we have a group. You can join to our group, and if any question, you can ask in the group. That's my WhatsApp. Well, the certificate will send it to you, an email, and because the folder is so big, we don't send it individual. We issue that, we put it on Google Drive, and you guys click the Google Drive link. You don't have to have a Gmail to access it. When you go into it, you download your you find your name, and then you download the PDF. That's it. You're welcome, Jason. Thank you, Eric. What link are you mentioned about? The quiz or the sign in? If you're looking for the sign in link, it's too late. You have to sign in the beginning of that. Okay, if you have to complete 2 links. Yes, the feet remain the same all the time, never change, unless they have a surgery. It may change. Otherwise, no, it won't change. Thanks, Alice. Thanks, Jody. Okay. Any question? Or stop recording.